صباح الخير. ازيكم؟ يا رب تكونوا كلكم بخير. ان شاء الله الفترة دي تعدي على خير. انا معاكم دكتورة مريم بهاء، مدرس من قسم الباثولوجي. ان شاء الله هسجل دروس اللي خاصة باللاب practical lessons من اول لما ابتدينا الاجازة، اللي هي عندنا Neoplasia 1 and 2، اللي هي Neoplasia 1 benign tumor، Neoplasia 2 malignant tumors. ده اللي خاصين بالموديول بتاع Introduction to Pathology. وبعدين بعد كده هنبدأ في دروس الانفكشن موديول اللي هي إن شاء الله من الأسبوع الجاي. هنعمل بس النهاردة إن شاء الله الليسون بتاعنا about البناين tumors. ده الجزء البراكتيكال بارت اللي خاص بالنيوبليجيا. قبل ما نبدأ بس هنعمل refreshing للميموري سريع على ال circulatory disturbance. Here is a case هنقراها مع بعض. A 60-year-old chronic businessman smoker fought with his partner. 1 hour later, he felt a sudden stabbing chest pain, which he injured. Next day, the man was found dead in his villa. Autopsy was done to investigate the charges raised by his son, convicting his partner for poisoning him. Examination of the heart in autopsy revealed the following picture. So, what do you think? This is TS in the heart, اللي هي ال TS في cardiac muscle. This is the viable area. Okay, what happens here? The cardiac muscle, the normal cardiac muscle, replaced by fibrous tissue. So, what do you think? What is the diagnosis here? This case is healed myocardial infarction. The patient suffered first from ischemic coagulative necrosis, followed by healing by fibrosis or scar, because the cardiac muscle is permanent cell. What special stain could be used to confirm the diagnosis that this tissue is fibrous tissue? The special stain is Mason trichrome, which gives the blue-bluish color, or the blue-green color. So all the blue-green area, or the blue-green color, is the fibrous tissue. Okay, so this is the first diagnosis, or the first slide. What do you think? This picture from which tissue? This is ghost of renal tissue. Here is ghost of glomerulus and ghost of tubules. So what is the diagnosis? The diagnosis is renal infarction. What type of necrosis? It is coagulative necrosis. Preserved outlines and lost all the cellular details. Okay. What do you think this tissue is? This is a lung tissue. Here is the carbon particle, or the anthracosis. This is the alveolar space, and this is the alveolar wall. What is here inside the alveolar space? Is it transudate or exudate? Of course, it is transudate. It is edema fluid and high power. You can see here some brown large cell, which is called heart failure cell or hemosiderin-laden macrophage. So what's your diagnosis? CVC lung or chronic venous congestion of the lung. Okay, this picture, what do you think the tissue is? This is a liver tissue. Is it normal or abnormal? Of course, it is abnormal tissue. Is it preserved architecture or lost architecture? It is preserved. Here is the central vein. Here is the portal tract. What do you think? The hepatocytes. What is the change happens here inside the hepatocytes? The hepatocytes show what is called fatty change or steatosis around the central vein and in the mid zone. What about the periphery? The periphery show normal hepatocyte. So the diagnosis, chronic venous congestion of the liver. This has happened due to right-sided heart failure. So the liver starts to suffer from hypoxia and that's why triglycerides start to accumulate inside the hepatocytes. Okay, this is a TS section in the blood vessel, but it's not normal because the lumen is occluded by mass. High power view on this mass formed of pale line here, the white star alternating with dark line, the red star, called lines of Dan. What is the lesion? This is a thrombus occluding the wall of the blood vessel. This is the wall of the blood vessel. So we refresh the previous lesson, the slides of the previous lesson. Now we are going to start to talk about the benign tumors. So what are the examples? We will study fibroadenoma, which is a benign tumor arising from the breast; squamous cell papilloma, a benign tumor from the skin; lipoma, benign tumor from the fat, our fatty tissue; capillary hemangioma, cavernous hemangioma, and cavernous lymphangioma. All of those are benign tumor arising from blood or vascular spaces, either blood or lymphatic vessels. Okay, before we start to talk about each one, I want you to remember the classification of tumors. We classify tumors according to behavior and cell of origin. According to behavior, we classify the tumors into benign and malignant. And the benign tumors and the malignant tumors are classified again according from where they arise. So the benign tumors could arise from the epithelial tissue, for example, papilloma or adenoma, and from mesenchymal tissue. And according to the origin of the mesenchyme, is it from the fat, is it from the muscle, from the cartilage, and so on. And also the malignant tumors are classified according to their origin, either epithelial or mesenchymal. If they arise from the epithelium, they are called carcinoma, and if they arise from the mesenchymal, they are called sarcoma. So the first tumor called fibroadenoma. Fibroadenoma, what do you think? Is it benign or malignant? Okay, from its name, adenoma, so it is benign tumor, but it is called fibroadenoma. What do you think the cell of origin? This tumor is biphasic tumor. What does it mean biphasic? Biphasic because it is arise from the epithelial component, which is adenoma, and mesenchymal component, which is the fibrous tissue. So fibroadenoma is a benign biphasic tumor. From its name, it arises from epithelial and mesenchymal component. Okay, before we go to the microscopic details of this tumor, we will mention some clinical keynotes regarding this tumor. Okay, fibroadenoma arises in females in childbearing period due to unopposed estrogen. What is the meaning of unopposed estrogen? Means that the estrogen is elevated and not antagonized by progesterone. What is the other lesion we studied previously due to unopposed estrogen? It is endometrial hyperplasia, okay, in the uterus. So fibroadenoma arising in female in childbearing period is presented by lump mass بتروح للكلينيشن ان هي بتقول له انا عندي كلكيعه في البراست. الكلكيعه دي بيسالها هتقول له ان هي slowly growing ودايما في الغالب تبقى accidentally discovered. Okay, on examination لما الكلينيشن start to examine this female patient, it is well circumscribed. It's not ill-defined or has infiltrative borders. It's well circumscribed. ولما يجي يعمل examination بيلاقيها بتجري من تحت ايديه. It's called freely mobile. The mass is freely mobile, like the mass of the breast. Cannot be fixed. بتجري زي البلية من تحت ايديه. ودي characteristic جدا sign for fibroadenoma. طبعا بيعمل another investigations like ultrasound and mammography. It is well circumscribed. Okay. if this mass is excised، يعني الماس التيومر ماس دي اتشالت، حصل لها surgical excision وراحت sent for the pathology lab. Okay, this is the fibroadenoma. As you see here, it's well circumscribed mass. Okay, under the microscope, this is the excised mass, cut section. It is well circumscribed, it has capsule, okay, and as you see, it is grayish white or tan in color. This tumor, as we said, is biphasic tumor. What is the meaning of biphasic? It's formed of epithelial component and mesenchymal component with the fibrous tissue. So, what do you expect to see? This tumor is benign, is well circumscribed and encapsulated. So, the first thing you will see a capsule. Then you will see proliferation of the glands and proliferation of the fibrous tissue. This is by very low power. Here is the capsule, and all the openings you see here, those are the proliferated glands and surrounded by proliferated fibrous tissue. So, fibroadenoma means proliferation of the glands of the breast and proliferation of the fibrous tissue. The fibrous tissue is the pink tissue, show the fibroblast or cells with spindle nuclei. This is the fibrous tissue, and those are the glands. This is the rare picture. Here is proliferation of both element glands. يعني ايه glands؟ اللي هي السبيسز اللي ليها اليومن وليها lining epithelium. و proliferation of the stroma اللي أنا بشاور عليها دي الستروما، في proliferation of the stroma. يبقى الفايبروادينوما في البريست هي proliferation of two elements glands and stroma. طب ازاي بنعرف ان في proliferation of the glands؟ الجلانس بيبقوا has variable size and shape. يعني some are rounded, some are tubular, some are cystically dilated. Increase في number of the glands, okay, and also proliferation of the stroma. طيب what is the sign أو pathological sign that confirm إن الجلانس دولت are benign, not changed to malignant glands؟ breast glands أو breast acini لازم يبقوا lined by dual cell layer. يعني إيه dual cell layer؟ بيبقى ليهم inner epithelial and outer myoepithelial. طبعا باللو باور دي أنت مش هتشوف الinner epithelial والouter myoepithelial بوضوح، بس أنا عشان أعرف إن الجلانس دول benign لازم يبقى عندهم dual cell layer. يعني إيه dual cell layer؟ يعني double cell layer. الinner بتاعهم بيبقى low cubical cells، ويبقى ليهم حواليهم الاوتر myoepithelial cells اللي هي بتبقى مسؤولة عن عملية الكونتراكشن بتاعت الجلاند عشان to eject milk. اوكي، فلو الاوتر myoepithelial cell layer دولت اللي surrounding الجلاندز بتاعت البريست ما بقوش موجودين، دي sign ان الجلاندز دي change to malignant glands. اوكي، let's see another picture. يبقى ايه ده كله؟ ايه الصورة دي كلها؟ ده cut section متاخد في التيومر نفسه في الفايبروادينوما. الفايبروادينوما again هي well circumscribed mass، فانا لما اخد منها cut section هتبان ازاي؟ هيبان لي البريفري بتاعها فيه كبسول اللي انا بشاور عليه، وبعد كده يبقى فيه proliferation of the glands و proliferation of the stroma. شايفين الجلانز هنا بيبقوا شكلهم variable في size and shape، ومفروض lined by double cell layer زي ما قلنا inner epithelial and outer myoepithelial، في proliferation of the stroma. لو الجلانز معظمها patent lumen بيسموا الباترن ده pericanalicular. يبقى يعني ايه كلمة pericanalicular؟ يعني الجلانز عندها patent lumen. يعني ايه patent lumen؟ يعني انت قادر تشوف اليومن بتاعهم. طيب لو الجلانز دولت بقوا compressed، اوكي، لو الجلانز شايفين دولت الجلانز بقوا compressed بالproliferated fibrous stroma، بنقول الباترن ده intracanalicular. يبقى احنا عندنا الفايبرو ادينوما ممكن تاخد two patterns either pericanalicular. البيريكاناليكولر اللي هو ان الجلانس بتوعك ليهم patent lumen، لكن لو الجلانس معظمهم compressed شايفين عاملين ازاي مقفولين مضغوطين compressed بيسميهم slit like spaces او star shaped spaces زي الصورة هنا. compressed بإيه؟ بالفايبرس ستروما بنسميها intracanalicular. طبعا ده misnomer لأن هم اعتقدوا إن الفايبرس ستروما دخلت جوه الإيه؟ الجلانس. This is not happened. هو الفكرة إن الproliferation بتاع الفايبرس tissue much proliferation of the fibrous tissue causes compression of the glands فappear في صورة slit-like spaces أو star shape. So we have two patterns either pericanalicular or intracanalicular pattern. Peri means that the glands have patent lumen, intra compressed lumen. Okay, so fibroadenoma is benign tumor arising in the breast. It is well circumscribed and encapsulated. It is biphasic tumor. What the mean of biphasic? Arising from the epithelial and mesenchymal component. Okay, and it is formed of proliferation of the glands and the fibrous tissue. This is a summary of the important pathological features of fibroadenoma. The second benign tumor is squamous cell papilloma. From its name, it is benign or malignant. Papilloma, oma means benign tumor. So, squamous cell means it arises from the squamous epithelium. This tumor, as you see here in the upper eyelid, a papillary mass or papillary protrusion, excision of such protrusion revealed this picture under the microscope, which is formed of stratified squamous epithelium, but it's not normal. This stratified squamous epithelium forming papillae. Papillary structures means projections, elevations, okay? So, what are the pathological features here? So, this is stratified squamous epithelium. It's forming papillae. What is the meaning of papillae? As we said before, any papillae in the pathology, that means you have covering epithelium and connective tissue core. This is the covering epithelium and this is the connective tissue core. Okay, so squamous cell papilloma show three important pathological features. The first one is thickened epithelium. The stratified squamous epithelium is thickened. This is called acanthosis. Acanthosis means that the squamous epithelium become thick. Okay. The second one, hyperkeratosis. Hyperkeratosis means that the keratin become much increase in the amount of keratin, much thicker. This is hyperkeratosis. Okay. This is hyperkeratosis and this is papillomatosis. What is papillomatosis? Papillomatosis means papillae, elevation of the stratified squamous epithelium. Okay, in medical description, increase the distance between the top and the base. Okay, this is the top and this is the base. The distance here increase, so form papillae or papillomatosis or elevations. Okay, this area in the histology called retiregis. So papillomatosis increase the distance between the top and the base. Okay, so the distance here increased, and this is in histology called dermapapillae. يبقى again المنطقة اللي انتوا شايفينها دي اللي هي الديبراسد دي اسمها retiregis. المنطقة الاليفيتد دي اسمها dermal papillae. الديستانس لما بيحصل papillomatosis بيزيد الديستانس ما بين التوب والبيز اللي هو الريتيريجس، ده معناها ان الدبس بتاع الديرمال بابيلي زاد. يبقى لما اجي اقول لك ايه هي الباثولوجيكال features of squamous cell papilloma, pathological features, three features which are hyperkeratosis, papillomatosis and acanthosis. يبقى again hyperkeratosis increase الكeratin, papillomatosis increase the distance between the top and the base, which is the retiridges. Acanthosis increase the epithelial thickness. This is called squamous cell papilloma. Squamous cell papilloma is a benign epithelial tumor. This is the summary of the important pathological features of squamous cell papilloma. So we talked about two tumors, which are fibroadenoma and squamous cell papilloma. Fibroadenoma arise from breast, which is a benign biphasic tumor. It's not only epithelial, it is epithelial and mesenchymal tumor. And squamous cell papilloma, which is benign surface epithelial tumor, arise from the skin. Okay. The third benign tumor called lipoma. Lipoma, from its name, it is epithelial or mesenchymal origin. Of course, it is mesenchymal and it is benign as it is oma, not sarcoma. So, what is lipoma? Here, this patient has back mass. It is well circumscribed. Okay. Excision of this mass revealed well circumscribed mass. It is yellowish in color and it is soft and it is lobulated, form lobules. Okay, so under the microscope, this mass is well circumscribed and capsulated. It has capsule. It is formed of lobules of mature fat cells separated by thin vascular connective tissue core. So this is a mass, a benign mass arising from the fat tissue. It is capsulated, it's formed of lobules of mature fat cells. Why it's called mature? Because this is important characteristic that this lesion is benign, it's not malignant. How I know that those are mature fat cells؟ ازاي عرفت ان دول mature fat cells؟ لو بصيت للفات cells تقريبا كلهم of the same size. So they are mature, they are benign. Okay. The next one is the real picture. This is the capsule. And as you see here, we have lobules of mature fat cells. يعني ايه lobules؟ يعني تحس ان التيومر متقسم لlobules زي نودولز كده under the microscope. واللوبيولز دي separated. شايفين كل السبتة دي very thin، بتبقى رفيعة جدا وبتبقى vascular، بيبقى جواها ايه البلاد vessels. اوكي، فدول كلهم زي ما انت شايف دولت mature fat cells. يبقى ايه هي اللايبوما؟ اللايبوما it's benign. Is it epithelial or mesenchymal? It's mesenchymal tumor. It is formed of lobules of mature fat cells and it is encapsulated. It has capsule. High power view. Again, this is the capsule. Those are the lobules of mature fat cells. شايفين كل الحاجات الرفيعة دي اللي فيها الكابيلاريز. These are the thin fibrovascular septa. Okay. Nature, it is benign mesenchymal tumor arising from the adipose tissue. Okay, another picture. These are lobules of mature fat cells. The fat cells here have signaturing appearance. Why? Because those cells are fat cells. They formed of fat inside. So the fat push the nucleus to one side, giving what is called signet ring appearance. This is a summary for the important pathological features of lipoma. Another benign tumor, which is also mesenchymal tumor, called capillary hemangioma. Capillary hemangioma, it is a congenital lesion. This is the eye of an infant. It's called strawberry angioma. So what do you think? This tumor called hemangioma. Hemangioma, is it benign or malignant? Oma, so it is benign, it's not sarcoma. Hemangioma means it's arising from mesenchymal tissue, which is the vascular spaces. So what do you think you are going to see under the microscope? You will see vascular spaces, proliferation of vascular spaces. Here is the skin, the stratified squamous epithelium, and under the epithelial tissue, this is not normal. Under the epithelial tissue is the dermis, which is connective tissue and showing the dermal structures. There is no proliferation of vascular spaces. Here you will see many vascular spaces lined by flat endothelial cells, because the vascular spaces lined by what type of cell? Flat endothelial cells. And inside the vascular spaces there are blood, RBCs. Okay, this is a tumor. But this tumor, one of the benign tumors that is well circumscribed but not encapsulated. So capillary hemangioma doesn't have capsule. It is well circumscribed but uncapsulated or non-capsulated. So this is the real picture. Here is the skin, the stratified squamous epithelium. It's arising in the face. So after excision of such a lesion, you will see the skin. Under the skin, in the dermis or in the subcutaneous tissue, you will see well circumscribed lesion. Here you see it is well circumscribed, formed of what? Many vascular spaces. But the size of such vascular spaces is small. Most of them are small. They are not large spaces. That's why it is called capillary. يبقى why it is called capillary؟ ليه قلنا عليها capillary؟ لأن ال vascular spaces small vessels, small in size, and show blood element, which is RBCs. Okay, so how do you know that this lesion is benign, not malignant? The first one, it is well circumscribed. The second one, those spaces lined by flat endothelial cells. Here the endothelial cells are flat. They do not show any malignant criteria. If those endothelial cells are malignant, they will be هتبقى هنا شايفهم بالعافية، هتبقى شايفهم كبار فيهم بقى الساينز اوف مالجنسي، البليومورفيزم والهايبركروماتيزم اللي هنتكلم عليها في المالجنانت تيومرز. فأول حاجة إن هي ويل سيركمسكرايب، تاني حاجة إن السبيسز دي لايند بفلات اندوثيال سيلز، تالت ساين والمهمة إن السبيسز دولت not branching not communicating. يعني إيه not branching؟ يعني ما تلاقوهمش عاملين branching، مش متفرعين وفي نفس الوقت مش مفتوحين non communicating with each other. فدي كلها signs بتقول إن التيومر ده benign tumor which is called capillary hemangioma. Another هنا high power view. As you see here, كل السبيسز دي هي دي الفاسكولار spaces اللي هم lined بفlat endothelial cells showing inside them RBCs or blood. ساعات بيبقى فيه small buds lacking اليومن، دي بتبقى اللي هي الاندوثيليال cells بيبقى عاملين buds زي كده خلايا لسه ملهاش اليومن، بعد شوية تبدأ تكون ايه اليومن وتعمل vascular spaces. So this is capillary hemangioma. Capillary hemangioma here arising from the skin. This benign mesenchymal vascular tumor. هنا high power view again. As you see here اللي أنا بشاور عليه ده اللي هو ده كده، ده الفاسكولار سبيس. شايفين دي النيوكلياي الزرقاء اللي هي بتاعت الفلات اندوثيال سيل، واللي جواها دي الار بي سيز. اوكي، دي كلها ار بي سيز. الفورث another tumor called cavernous hemangioma. Cavernous hemangioma من اسمه يبقى هو أكيد زي الكابيلاري hemangioma. هو it is also benign mesenchymal vascular tumor. طب what is the difference between capillary and cavernous? Capillary means that the vessels are small in size, while cavernous large vessels. Okay, this is the difference. And another difference, capillary hemangioma usually بتبقى superficial، بتطلع في superficial locations. لكن الكافيرنس هيمانجيوما بتطلع superficial، يعني ممكن تأرايز في السكين وممكن تبقى في الايه في الديب اورجانز زي الليفر. اوكي، فدي الكافيرنس هيمانجيوما. ده انفنت هنا عنده كافيرنس هيمانجيوما في السكين، وهنا ده سكشن في الليفر. يعني كل اللي انا بشاور عليه البني ده هو ده التيومر، واللي حواليه ده الليفر تيشو. اوكي، يبقى الكافيرنس هيمانجيوما هنشوف لها صورة في السكين وهنشوف لها صورة في الايه في الليفر. اوكي، هنا دي الصورة الحقيقية اللي احنا شايفينه. طبعا هنا التيشو اللي حواليها ده الليفر تيشو، ده الهيباتوسايتس. اوكي، امال ايه التيومر ده vascular spaces. هل هم small vascular spaces ولا large vascular spaces؟ لا، هم large، عشان كده called cavernous hemangioma. وانسايد الفيسلز دي RBCs. طب هل التيومر ده ليه برضه كبسول ولا هو well circumscribed؟ لا، it's well circumscribed, no interfacing كبسول. يبقى التيومر circumscribed زي ما انتم شايفين لكن مفيش ايه كبسول non capsulated. بيبقى عبارة عن large vascular spaces lined by flat endothelial cells and showing blood. اوكي النير باي تيشو ده ليفر، بس زي ما انتم شايفين الليفر فيه ايه steatosis or fatty change. يبقى ايه هنا الليجن ده cavernous hemangioma in the liver. Another picture again is well circumscribed but not capsulated. This is large vascular spaces lined by flat endothelial cells not communicating with each other, not branching, or containing blood. A nearby liver tissue showing steatosis. Here is the cavernous hemangioma بس فين في السكين. ادي ال stratified squamous epithelium وادي ال large vascular spaces اللي هم containing ايه blood. اوكي so ال capillary hemangioma بتبقى superficial بتبقى في السكين. اوكي لكن cavernous hemangioma ممكن تبقى superficial وممكن تطلع في ال deep organs زي الليفر. ده summary لل important pathological features of cavernous hemangioma. The last lesion called cavernous lymphangioma. So it is benign, oma, if it's benign tumor. Lymphangioma means it arises from the lymphatic vessel. It's mesenchymal in origin. So this tumor arises from the lymphatic vessels. Here is the tumor. This is the mass arising at the lateral side of the neck. It is usually congenital in infants. It's called also cystic hygroma. What do you think you are going to see under the microscope? First, you will see lining skin, okay, stratified squamous epithelium, and under the skin and under the epithelial tissue in the dermis and in the subcutaneous tissue, you will see what? Vascular spaces, which are the lymphatic spaces. Okay, lined also by flat endothelial cells. But the difference here between those spaces, there is stroma reaching lymphocytes. Okay, this is the real picture. Okay, what are those spaces? Those spaces are the vascular spaces, which are the lymphatic spaces. How I know that those spaces are the vascular spaces, lymphatic, not blood vessels. اوكي ايه الفرق ما بين الكافيرنس ليمفانجيوما والكافيرنس هيمانجيوما؟ ايه الفرق؟ كافيرنس هما الاثنين large spaces but ايه هي الليمفانجيوما وايه الهيمانجيوما؟ هما الاثنين lined by flat endothelial cells بس الديفرنس هنا ان inside the space there is no blood. This proteinaceous material البينك ماتيريال الفاتح اللي انت شايفه ده الليمف. اوكي يبقى again cavernous lymphangioma and cavernous hemangioma both are benign vascular mesenchymal tumor. لكن cavernous hemangioma blood vessel لكن cavernous lymphangioma lymphatic vessel. Both are large spaces, both are lined by flat endothelial cells. لكن الفرق ان في cavernous hemangioma انت جوه inside the space بتشوف RBCs بتشوف blood لكن cavernous lymphangioma بتشوف ايه؟ بتشوف proteinaceous material اللي هو الليمف. ده حاجة. تاني حاجة السبيس اللي حوالين الستروما in between ده lymphatic vessels show lymphocytes. الصورة هنا هكبر عليها اوريكم النقط الغامقة الموف دي كلها lymphocytes. امال ايه الفات سيلز دي؟ احنا قلنا هو بيطلع في السب epithelial تحت السكين فالسكين ده تحتيه هو عبارة عن ايه؟ هو عبارة عن epidermis and dermis and subcutis فده في السبكيوتس بيبقى فيه ايه subcutaneous fat. هنشوف another picture. شايفين ادي الفاسكولار سبيسز هل هي جواها RBCs؟ لا امال جواها ايه؟ شايفين الماده البيل بينك دي البروتينيشنس ماتيريال ده الليمف. اوكي فده كده cavernous lymphangioma. طب in between السبيسز ده there is ايه؟ there is lymphocytes. النقط دي كلها lymphocytes وساعات الليمفوسايتس تبقى prominent قوي up to ان هي تعمل لك what is called lymphoid follicles. امال ايه الفات سيلز دي؟ دي subcutaneous tissue. خلاص هنا الصورة بس مش بتوريك الإبيديرمس مش بتوريك السكين كافرد. أوكي هي جايبة على التيومر بس اللي هو موجود فين في الديرمس والسبكيوتس. أوكي so cavernous lymphangioma is a benign vascular mesenchymal tumor arising from the lymphatic vessels. Okay, it's formed of large vascular spaces lined by flat endothelial cells, some spaces filled with lymph the stroma in between show lymphocytes. Okay, this is another picture. كل دولة lymphatic vessels. اوكي، وده الليمف البينك ماتيريال، والنقط دي اللي هي لونها purple هي دي الليمفوسايت. برضو السبيسز دي بتبقى non communicating non branching. هنا high power view as you see here. شايفين النقط دي اللي في الستروما هي دي الليمفوسايت، وده كله الماتيريال اللي موجودة جوه دي كلها هي الليمف. another picture. هنا البينك ماتيريال هي الليمف. هل في اي RBCs؟ لا. خلاص الار بي سيز شايفين هنا البلاد فيسلز الكمبريسد اللي بتبقى في الفايبرس ستروما ممكن نشوف بلاد، لكن inside the large vascular spaces كله pink material proteinaceous material اللي هو الليمف. اوكي، وهنا شايفين ده subcutaneous fat. دي another picture. هنا كل اللي جوه السبيس ده الليمف، والنقط اللي في الفايبرس ستروما دي الليمفوسايتس. Thank you dear students. إن شاء الله الدرس الجاي هيبقى Neoplasia malignant tumor. Thank you very much.